When we talk about blood pressure, what is blood pressure? Well, blood pressure is simply the force that's against the walls in the vessels of your body. And when we look at blood pressure in the vessels of your body, we look at it based on two parts of that force. One is when your heart is pumping all the blood out of your heart, and that is called the systolic, and that's just because that's what we call it when all the blood gets pumped out of your heart during a normal beat. That force is the top number of your blood pressure. We call that the systolic blood pressure, or sometimes it's abbreviated SBP, meaning systolic blood pressure. That number will always be higher than the other number. The other number happens when your heart is relaxing. So as your heart is relaxing, we're looking at how much force is still going through the blood vessels in your body. That's typically called the diastolic blood pressure, and that just has to do with the fact that that's what we call that phase of the heart when it's actually filling back up with blood. And so the diastolic blood pressure is the lower number of the two, and it happens to be usually that we call this a DBT, so diastolic blood pressure. So when we look at the numbers, it's usually abbreviated. For example, 120/80. The 120 would be the systolic blood pressure, and 80 would be the diastolic blood pressure.